Welcome to this SCG Health Give Me 15 Minutes education program for medical professionals. My name is Jennifer Searfoss, and I am the CEO of the Searfoss Consulting Group, which generally goes by SCG Health, so you can spell my last name. We opened our doors in 2011, and we focus our client services on value improvement, revenue cycle management, and strategic planning in this post-health reform world. This presentation will address what you need to know about how to collect quality data and workflow change in your medical office. This session, along with many others, is available for free as a video archive and download on our YouTube channel, which you can find at the top left-hand side of scghealth.com. SCG Health also offers in-person conferences on many topics, including coding and documentation, compliance, and EMR implementation. Learn more at scghealth.com. One quick legal note: none of the information contained in this presentation should be construed as legal advice. I encourage you to contact counsel if you have any questions regarding state or federal law that apply to the concepts covered in the session. And with that, I'm going to get started on the general information that you need to know about collecting quality data. I am going to address, since SCG Health is a Qualified Clinical Data Registry, a QCDR, I'm going to address what we do, but I'm generally going to start with some of the ways that you can start in your medical office. So I'm first going to start off with something called measure specifications. You may have seen these before. They are available on the CMS website. I'm going to show you quickly where those are here in just a second. But these are PDF documents that come out each year. I'm showing you the 2017 specifications right now. We anticipate the 2018 be issued any moment now, but we don't have those yet. So in the meantime, I'm going to show you the 2017 data items, since data is actually going to be collected here in the spring. But let me show you where you can first find these. So if you are a junkie like I am and go over to the qpp.cms.gov website all the time, you're going to get over to something called the resource library. The way to navigate there is, if you are, let me move this over a little bit so I can see. So if you start over on the far left-hand side in the About, you can click on Resource Library, and it's going to link you over to this new cms.gov webpage. They moved everything over here. So this is the PDF documents are a large download, and I am a big fan of searching. So you can do a search for 2017, but that's a lot of documents. So instead, if you go into specialty specifications here, let me see if I can make this a little bit bigger for you. They've divided these documents, instead of being one large file, they have divided them up into files that are by the measure number. So it's very good if you happen to know the measure number of a quality measure you're looking for the specifications, because that way you can get into them. And there are two different kinds of specifications. There's one for claims-based reporting. That's if you're submitting a claim to CMS with a G code or CPT type 2 code on it, or if you're submitting it through a registry. And since SCG Health is a qualified clinical data registry, we're going to focus on those. Just know that there's two, and you can find out what they are right here on the individual specification. So just a quick note too, each of these are copyrighted. I'm going to be sure to go ahead and add this back in. Both CPT is copyrighted, and each of these measure sets are copyrighted. The one we're looking at right now is actually owned by CMS. So make sure I spike that out there. So one of the things that when we start looking at a measure specification, and I'll talk a little bit too about, if you don't know where to start, where you can start, but we're going to start here with one of the ones that honestly everyone should be doing if you're able to report it, which is documentation of current medications. This is measure 130. For some of you that have an EMR that includes this measure, it is also an electronic clinical quality measure, so that may be something that you can capture in your system. But this measure is for documenting for all of your patients that are 18 years of age and older, all of their known prescriptions, so items or drugs, prescription drugs that have been written by another clinician, but also over-the-counter drugs. So for example, I personally take Allegra D for my allergies, so that would be an over-the-counter. Herbals, I'm really a big fan personally right now of CoQ10. That is my new thing to keep my energy going. So that would be an herbal or vitamin or dietary supplement. And I'm also taking probiotics, so that would be something else that would be in my list. So those are the items that need to be collected, and this measure specification is very clear that it needs to be the name, dosage, frequency, and route of administration, which could be oral, an injection, etc. So there's a lot of information that needs to be captured to be able to meet these measures. The other thing too is that we need to make sure that it's eligible. So in the measure specification, it will have what they call the denominator, meaning the eligible encounters. Those are typically done by age. So here for measure 130, it is patients 18 years of age and older on the date of encounter. But then also there has to be a billable encounter code that falls into the listed specifications. So typically when we talk about these measures, we are going to be talking about E&M services. So these are face-to-face encounters between a clinician and a patient, and those are going to be the types of services. Now there's others obviously by CPT code here listed, but we're going to focus on the E&Ms for this measure. So we talked about what's qualified, some of the information that needs to be included. And then there are some definitions that are included in here and other information. But if you go to page 2, on performance met, a denominator exception, and performance not met, the measure specifications from CMS do include these fancy little G codes. Now, G codes are owned by CMS. These are called HICS Codes. And what's interesting about these codes is that you can use them in your system to actually capture the quality data. So it's really a question of what you want to do. MIPS, the merit-based incentive payment system, where we're capturing quality data, is just a next generation of the previous physician quality reporting initiative, and then the system PQRS. Been around for over a decade. So these are G codes that your system may have had, but you were including them on the claim. Now, this data needs to be collected for registry reporting for all payers. So that's including self-pay, workers' comp, and all of the commercial payers that have Medicare, Medicaid, everybody. So these aren't G codes that you're going to want to put on every claim because you're going to upset all your commercial payers. Instead, this might be something that you can put into your practice management system as a non-billable code. Non-billable code. That may be a possibility for you so that you're able to capture this information as part of your previous workflow. So maybe you had it on your actual bubble sheet or your super bill, whatever you want to call it. Maybe you have that information there, and now all you're going to do is continue to use that information. That's one way you could do it. And the way that the system is set up is it hasn't changed. So you still have that available. We'll just look at a CPT section here that's more for anesthesia. So this is measure 426, post-anesthetic transfer of care, where you're going over to a PACU. So this is going to be anything that is not in the inpatient setting and not going to the ICU. So that's really the only difference. So you have a PACU in a medical office, or you can have a PACU in an ambulatory surgical center. It's not that specific necessarily that, it's labeled PACU. But as you can see here, the CPT, the denominator codes here are very different. These are for anesthesia services for measure 426, and it is all patients. So there's no aspects there that we need to worry about for age. But they do need to go to a PACU. So there's a G code that's specified here. And again, more G codes for performance met and performance not met. So there are 2 G codes that would need to appear. One, that they went to the PACU and that there was performance met, that there was a checklist and you didn't abandon them in a hallway somewhere or set them off into the parking lot without allowing them to recover. We all know that you're doing it. So really at the end of the day, it is about documentation, whether or not you have the checklist or protocol documented. And really we're looking for documentation in the medical record, which I know is super duper hard. So we work with our clients on trying to work through that and how you can improve your workflow for the information. But it still goes back to, if you want to include these G codes on your bubble sheets, on your super bill, and so that it's captured in your billing system, your practice management system, and doesn't go out on a claim, instead it's held as being non-billable, you're going to generate a file. So let's go look at what that might look like. The file could look like this. This is some sample data. Here, this is for sleep apnea, where specifically new columns were made for sleep apnea data. We are picking on Martha and Johnny Appleseed here. So those are opportunities that you could use where you're creating a new column for the data, and that those denominator codes are over in a separate area. So that might be something to look at. Or you could actually include in those codes area, in the individual rows, you could include the quality data information. So it's really up to you on how you want to send it over. Things that most every registry is going to be looking for. Either there needs to be a unique patient ID, or they're going to need these 3 pieces of information: the patient first name, last name, patient name, and date of birth. We love doing patient zip codes because that really, really helps us when we have common names. For example, John Smith. We love having ICD-10 codes, and I'll show you an example of a measure specification that does include I-10 codes as part of the measure specification. They need to know primary and secondary insurance, because again, remember this program for registries is no longer just Medicare. We need to know who did the service. Typically, we're looking at the billing NPI, but I'm a big fan of including the rendering NPI. The billing TIN, what TIN was it billed under? Because the TIN and NPI are the unique identifier that we use with CMS. When the service happened, big fan of including place of service and the code and any modifier that's related to that. So that's a little bit about the sample data. I have some other examples here that we'll walk through in a second, but know that there's great opportunity for you to use the data out of your practice management system, or honestly, by hand, you can create this too. We have a couple of our clients that do that for us as well. We do have a template of the data just to give you an idea of some of the information that's out there. This is on scghealth.com if you're looking for a template, and I'll show you where that lives here in a little bit. So let me go back and start more broadly with what if you do not know at all, have any idea what measures you're going to report, right? So starting out at specifications makes no sense. Well, then you're going to go back to QPP, qpp.cms.gov, and then under MIPS, you're going to hit quality measures, because that's what we're talking about here. And there's a whole list of quality measures that are focused here. Now, there's two different kinds of measures that are out there that have some extra points. Those are high priority measures and also something called outcome measures. So those are two different types of measures that you might want to look for. You are required in 2017 to do your best to report one of those if those are available. Measure 130 that we looked at previously, documentation of current medications, is a high priority measure. So I definitely recommend taking a look at that nice, easy, straightforward one for you and your workflow. But you also could look at something that's related to your specialty. So since we were picking on anesthesiology, you could choose anesthesiology as being a CRNA, and you would have several measures that came up. Now, I will note documentation on current medications, they are incorrect. That is not available to you, and that has actually been removed because they screwed up on that one. So know that that is not available to you. But measure 424, if you do a lot of services that are general anesthesia, not MAC, and are longer than 60 minutes, measure 424 might be one of those. And you can see the measure ID down here. That's where that is located. But the measure specification, if you notice more details about it, it's not located here. There's no G codes, there's nothing else for you to look at. So this is really a place for you to go and find out your measure numbers, and then you can step back and find out more information about it later. But again, the specialty measure set might be something for you to look at. These are suggested measures just from CMS, so you can choose to look at all of them or none of them. So we're going to actually look at a couple of others that are more general medicine, just because we think that that gives you a broader aspect related to healthcare just generally. But know that these are available for you, and you can go and choose your measures based off of that. The other last thing that I'll point out is that if you, as you're moving into 2018 and you're looking to care about points, there's an entire video that SPG Health did. It's available for free on our YouTube channel called MIPS Math. I'd highly recommend that you sit through that one so that you can learn more about MIPS Math and where you can get the information. So I'm going to walk through some of the measure specifications that I've downloaded from this location on the CMS website. So let me just go ahead and pick on measure 226. So this is another general item that many, many clinicians are going to do. It's in the top 10 right now for clinicians reporting across all specialties. There's a slight change in 2017 reporting for measure 226. It's now, unless you are doing sort of preventive services, the denominator has changed. It's stated 18 years of age, but it's now requiring 2 patient encounters. So a preventive encounter is okay, but it's really for the majority of our clients who are specialists, it's going to be 2 patient encounters, and still it's going to be E&M services. So you know those are services that the majority of our clients do perform, but just keep in mind that there's going to be 2 during the performance period, which in 2017 could be 90 days or could be 6 months, could be a full year. So whatever your performance period is. Other things for you to know is that there are modifiers that you need to care about on this one because these are CPT type 2 codes. These codes here are, so 4004F would be that they are a smoker and they receive cessation, but also you have non-smoker codes. If you have an exception, meaning that they are, let's say, end of life, or an emergency, that would be one, but also you have the performance on that, which is 8P. So know on this one, again, your CPT type 2 codes are using modifiers, so that's something that you'll need to capture in your data. So let me show you what that might look like just real quick. So again, if you're using modifiers right here, this is actually a separate code, but this will show you where you're using the modifier to actually on the same line as your quality code. So the last one I'm going to pick on is measure 1, which is diabetes. And this is an interesting one because not only does it have an ICD-10 qualifier for its denominator, but also it's an inverse code. So because the measure is diabetes, hemoglobin A1C poor control, meaning that your patients have their sugars out of control, you don't want a lot of those, right? You don't want to have 100% performance on that, because that means every single one of your diabetics has something that's super duper awful. Instead, what you're looking for is to have a lower, and right now the target's about a third of your patients should have bad A1Cs and 2/3 should be under control. So things to know is that you would need to include one of the E codes for the type of diabetes that they have. That obviously would need to go on one of the claims, so that would be something you would need to report to the registry. You'd also need to do, again, some E&M services for this code, so that's out there. So here's your 99201, 215. So E&M services here as well, and then there are different codes in here. Now, the way that this is set up for poor control means that they need to have come in 2 different times. So just remember that is something that you need to keep in mind sort of as part of this, is that you really need to have a baseline and a follow-up. So it's the most recent A1C is less than 9, or A1C was not performed during the measurement period. So that's something that this would be an 8P. And then not met is that they were greater than 7 or 7 to 9. So just keep in mind that, this is an interesting measure where you are not going for performance met. You don't want it. You don't want an A1C that's higher than 9. You would love for it to be something that is performance not met. So just keep that in mind with this one. And this is actually copyright, just so I can spike it out, is by the National Committee of Quality Health Assurance. And measure 426 that we talked about earlier is with the American Society of Anesthesiologists, ASA. So that's a little bit about the measure specifications, and I've shown you some examples here of how you could spike out your data in such a way that you are using your practice management system to grab it. But let me show you the other way that we do have clients sending over data, and we talked about measure 128 and 226 just previously. So let me show you this, and this is just a sheet where, again, you put your NPI and TIN up top, patient name and information here. And then you're going to go through and figure out what applies. Now, some of this information you're getting from the patient intake form, which means that you're transferring information from the intake form over to either a form like this or to the bubble sheet. And it really depends on, that super bill, if the clinician is using that or not, or if this is where you want to go. This is something that's available on our website as well. We have a couple of other sheets that are available. We call them our quick reference guides. So check those out, see if those are helpful. We did try to set those up as being available by specialty. So let me just point you over to a couple of resources that I've talked about today. So let's just start with scghealth.com. So when you're going in, right in the middle of the page is MIPS reporting, and that's where everything lives over into the FAQs, quick reference guides, quality reporting. All of that's going to live right on this page. Just since we are a QCDR, our enrollment is going to close in February, so February 14th of 2018. That's the last time. That's the majority of data we really want in by then, because it does take us time. So we submit our data by hand. We're old-fashioned. Submit it by hand over to CMS. So that's the first one. The second one is qpp.cms.gov. I highly recommend that you head over there. If you are not sure if the MIPS program in 2017 applies to you, feel free to put in your national provider identifier and check your NPI. If you do not know what your NPI is, you can go to npiregistry.cms.gov health.hhs.gov, and you can search your name and last name, first name and last name, and find your NPI. The last one to point out to you is this resource library. So if you go under Medicare over to QPP and the resource library page, you'll find this resource library that has all the information that we talked about, specifically the measure specifications. And then here is some information here that is for finding resources by provider. So that's a little bit about how you can change your workflow and capture data, some resources that are available to you from SCGHealth.com and CMS. And some other opportunities that you may have on capturing data. So with that, I just wanted to quickly remind you that we do have an entire section of videos on our website, which is our channel called Give Me 15 Minutes. So feel free to check that out and see more information. And if you want to receive automated notices about that, you can become a subscriber. Big fans of getting subscribers. You also can sign up for the SCG Health blog up here at the top of our website, and that will give you notices about our blogs, but also about events and other programs we have coming up. And we do have a number of events that will be going on throughout the winter season. So if you're interested in more information, that's on spghealth.com. So with that, I would like to thank you for listening into this session. We hope that this was something that you found interesting and helpful. And if you have questions, feel free to contact us here at SCG Health. You can either email me or my colleagues, and we definitely enjoy having questions come in. So I hope that you've enjoyed the presentation. For those of you watching the video archive, please remember to rate this video. To receive notices about upcoming Give Me 15-minute programs and other educational sessions, please sign up at spghealth.com. Thank you for joining me for this 15-minute education program. This concludes the presentation.